But when you're doing a specialty practice, when you're focusing on something unique that nobody else does, you stand out in the marketplace.
Welcome to AMC. I'm Dr. Greg Miller. Have you ever wondered about condition-specific marketing for your chiropractic practice? Today, Dr. Bill Kriva is going to share about specialty practice marketing. The part about determining what is unique in your background that can potentially become your practice specialty was very helpful to me. Let's get started.
Hello, my name is Dr. Bill Kriva, and I am an instructor and a coach with AMC. And I wanted to take just a few minutes today in between patients, as you can see I'm in the office seeing patients today, to talk with you a little bit about a topic that can be extremely helpful for you and your practice and your long-term practice growth and success. And that topic is specialty practicing. What does that mean? Specialty practicing means that you do something in your office that is different, that is unique, that is a focus for your office that is different from all the other offices in your particular market. And specialty practicing can be a heck of a lot of fun. First of all, why would you want to do something like this? I think you'd probably agree with me that if you look at general chiropractic offices across the country, they're all pretty similar, aren't they? They all pretty much do the same thing. They have very similar layouts. There's nothing that really separates these offices. But when you're doing a specialty practice, when you're focusing on something unique that nobody else does, you stand out in the marketplace. And you can very quickly develop the reputation as being the go-to office in your market for a particular condition, a particular problem. Now, how do you do this? Okay, what do you focus on? Well, the first question that I need to ask you is, do you have any specialized training, any specialized background that is unique to you that nobody else has that you can then capitalize on and turn into a specialty practice? I'll give you an example out of my own life. I was an engineer for 12 years. I was trained as an industrial engineer, and a part of what I did for 12 years was injury prevention work. I worked in industry helping reduce the chances people were going to be injured in the workplace. And when I went to chiropractic school, I then added the health perspective and the biomechanical perspective that I didn't have when I was an engineer. And it made for a very unique combination. And as a result, when I got out of chiropractic school, I went to the companies in the town where I was practicing and offered to go in and do injury prevention evaluations for them, basically at no charge. I went in, I took a look at their workplaces, I looked at their workstations, helped them reduce the chances that they were going to have work comp injuries, and in the process established a relationship with these companies and the reputation as the chiropractor to business, to industry. And as a result, as the relationships grew, I was able to get into do talks to the employees on health and wellness topics. I was participating in their employee wellness events during the course of the year, sometimes doing screenings. And I was getting referrals from these companies to other companies in the area who had a need for similar type services. And the interesting thing, going into the companies, they were not particularly interested in having a chiropractor come in and solicit work comp cases. And I told them point blank, I would not take a work comp case from them unless they made the referral themselves. And guess what? As we grew in our relationship, I became the go-to chiropractor for work comp cases as well. I was the one that they were sending these cases to when they got hurt at work. So bottom line, I had something unique in my background, in my training, that I could capitalize on to turn into something very different. I was doing industrial chiropractic before industrial chiropractic existed. I know they now have certification programs and this whole thing, but that's what I was doing. So where am I going with this? Do you have something unique in your background that you're passionate about, that you would love to do, that you can capitalize on and turn into a specialty practice? So think about that. Next thing, what do you love to do? What do you love to do? I know docs that absolutely love sports. They love sports. They love sports chiropractic. They love everything to do with it. If you're passionate about that, then why not focus your practice on sports practicing? Okay? If that's something you love to do, you're going to be good at it because you already love it. It's just a question of getting out in the marketplace. And I'll explain how to do that here in just a little bit. Do you have specialized training? I have a doc that I coach that has training in working with TMJ. TMJ cases are very frustrating for dentists, general practitioners, because they don't respond very well, even to things like the mouth appliance that they put in. And as a result, they get frustrated. They can't get good results. We, as chiropractors, have the ability to work with TMJ cases and get results where the dentist maybe can't do that. So if you love doing that type of work, why not focus on TMJ practicing and get relationships established with the dentists in your area? Let them know that you can take the cases and get results with cases that they're having difficulty with. Wonderful, easy thing to do. Okay. There are a lot of different things you can go after. Fibromyalgia within AMC. I know we've had Fibromyalgia Centers of America active, and there are docs across the country that have taken Fibromyalgia Centers of America and turned it into a fantastic specialty practice. If you love working with fibromyalgia cases, this is a no-brainer. This is a perfect fit. Now, if you don't care to work with fibromyalgia cases, obviously you want to pick a different direction. So give you some food for thought. Sit back and think about this a little bit. Then how do you get this out into the marketplace? The same ways that we've talked about before. Networking. If you're going to do sports chiropractic, get out and network with the sports teams in your area. Get out and network with the athletic trainers in your area. Maybe get involved in sports, maybe as a coach, get involved in sports as a referee. Something like that that gives you the ability to meet people, to make connections in the particular target market that you're looking for. Fibromyalgia. Are there fibromyalgia support groups in your area? Maybe you could start a fibromyalgia support group if you want to go that far and do something like that and establish that reputation as the place to go. If you've got fibromyalgia, meet people with fibromyalgia. They're going to refer people because I promise you they know people who've got fibromyalgia. So networking is a great way to get your specialty out there. How about doing presentations in the community? Again, speaking about your particular specialty, your particular focus. Another doc I know coached at one point was focusing on disc cases, wanted to be known as the disc destination for his market. And so was out doing talks on disc problems. What can you do to manage disc conservatively through chiropractic? And doing health talks in the community was able to get the message out that that's what his office was all about. You can do screenings. Fibromyalgia Centers of America have had screenings where people can come up and talk to you about fibromyalgia. It's not doing massages or it's not doing posture screening, but it's very specifically having conversations with people about their particular condition. It can be arthritis, chronic pain, things like that, no problem. And also getting connected to some of the professional organizations in your area. For example, if you want to do industrial practice, you want to focus on those types of cases, why not get connected to the human resources organizations that are active in your marketplace? Interestingly enough, most of the people who handle employee health and wellness issues in a particular company are human resources professionals. If you're involved, maybe going to their annual convention, setting up a booth, getting into communications with them, if you're involved in that group, then you have the opportunity to make connections that you might not otherwise have the opportunity to do. One more thing, is your office face to the marketplace congruent? If you have a specialty practice, does your website reflect that specialty practice? Are you putting blog posts out that reflect that specialty practice? Do you have videos that you're putting out that reflect that specialty practice so that the message is consistent into the marketplace that this is who you are, this is what you do, and you're doing education. You're establishing connections with people who may have problems or may have the condition that you're looking to specialize in. But it has to be a consistent message. This is not something that you go do a talk on fibromyalgia and people who are looking for fibromyalgia can't find anything on the internet about you. You don't have any mention of it on your website. You want to have a consistent message all the way through. Here's the point. If you choose to do a specialty practice, this can be a heck of a lot of fun. I loved doing the industrial consulting work that I did because it blended the engineering background that I already did and was already good at with the chiropractic, which was brand new and fresh. And it made it very, very interesting to go into these different companies, see what they did, look at their processes, and really help people stay healthy and avoid getting injured. It was a passion of mine at the time, and it absolutely was rewarding as well from a financial standpoint. Specialty practicing can be very rewarding from a financial standpoint as you start getting a reputation for your specialty and start drawing from a bigger radius. We have a doc in AMC who focuses on scoliosis, who's now drawing patients from all over the Midwest at this point because of his reputation and his success with scoliosis. So throwing this out here as food for thought for you, docs. This can be something that you can think about. Take it to your quiet time. Let your innate guide where you go with this. Let your innate inspire you in terms of insights, new ways to go about specialty practicing, and where you, as a unique doctor of chiropractic, what sets you apart from every other chiropractor, this is your sweet spot, and this is where you can practice, and you can be successful with this, and you can also make a few dollars in the process as well, which isn't a bad thing. So hope you got something from this. If you have any questions, you're more than welcome to contact me. Catch me at a boot camp. I'd be happy to talk with you more about it. So be blessed, and we'll talk soon.
Join us for an in-depth live Zoom meetup on marketing Thursday, September 23rd at 1 p.m. Eastern. Visit amcfamily.com/calendar to register. AMC is your guide to becoming respected, effective, and valued in practice. See you next week.